Now, for the Gazan conflict survivors, a gift of the givers has been able to acquire medical supplies and other relief materials in the midst of a second week of hostilities between Israel and Palestine. The South African organization headed to Gaza shortly after the deadly clashes, armed with medical supplies, medication, and wheelchairs. Dr. Imtiaz Sooliman, the organization's founder, said they were also providing clothing and toiletries. Hospitals, however, have not been spared from the disaster. The group has called for contributions to help continue providing aid. Now we have Dr. Imtiaz Sooliman, the organization's founder, joining us live. Good afternoon, and thank you so much for joining us, Doctor.
Good afternoon. Thank you very much. Just to correct something in the beginning, we didn't move in with aid after the war happened. We have offices inside Gaza. So we have a presence in the country since 2014. As my team's inside, they purchased the stuff and started moving around to the different areas, though it's very, very difficult.
All right, thank you for that. Now, but let's thank you, first of all, for the good work that you and your organization has continued to do. And we understand your team is on ground in Gaza. Can you take us through on the humanitarian aid that you're providing, and how long has Gift of the Givers been providing humanitarian aid to Gaza?
We've been in Gaza since 2014. We've been involved in Palestine for quite a long time. In 2009, when the war happened, we took in medical teams and supplies. And in 2014, during the next war, we got involved during the war, but then decided to put up a permanent facility there. We've got a women and childcare center. We look after orphans. We provide food. We support medical teams. We support hospitals. We run a clinic. We put up 3 desalination plants. We help people when their houses get damaged to bombing or floods or whatever. And we bring in specialized surgeons to do kidney transplants. We give specialized medical equipment. We support preschools. It's all those kind of things that we do. When the bombing happened on the 7th of, it was on the 8th of October, the first time the bombs fell in Gaza, we had already started procuring essential supplies from what was inside the country. We spoke to wholesalers selling medical supplies. We spoke to those who got hygiene items, those got clothes, those got food, and we started distributing whatever we could to get to the hospitals. And it was predominantly starting with hospitals, sending in medicines, consumables, medical equipment. And the patients who came, they came directly from a bomb site. They didn't come, with ready dressed or with supplies. So we provided clothing and hygiene packs for them. And of course, after the procedures, those who need wheelchairs, we provided wheelchairs. Then we have 3 desalination plants. But because there's no electricity and limited fuel, they couldn't work. We managed to get generators connected to those desalination plants and then started providing water. To save fuel, because instead of putting the water tanks on cars, we put them on donkeys. And so the donkey carts went around taking water in the different areas. And then, of course, people are hungry and they got no money. So because we're so well known in the region, we started giving food vouchers, or not necessarily food vouchers, vouchers. They go to a shop and take what they want, whether they want clothes, hygiene items, food, baby milk, milk powder, whatever they want. They use those vouchers and we pay the companies later on. That's as much as we could do. And of course, we provided food to all the children in the UN refugee camps. We couldn't do more than that because you can't get enough supplies and you need full medical teams, which we are on standby for. If opportunity arises, if there's a ceasefire or if there's a humanitarian corridor, we've already 40 medical personnel, all highly skilled trauma specialists, ready to go inside to give those doctors who are exhausted a helping hand.
All right, Doctor, fantastic work you're doing in Gaza at the moment. And you did talk about some of the challenges that you're actually facing. But can you tell us, how is your team able to navigate these challenges, especially the political and security complexities of operating in Gaza?
My team, as Palestinians, they've been living there for years. We don't have any political issues because we focus purely on the humanitarian. What they do is they build networks. During the time of the war, I've actually instructed them, and I'm sorry I had to say this to them, in a very open way, to say the reality is that they could die in this conflict. There's no escape. There's no borders to get out through. There's no safe zone. There's no such thing as a safe concept or a safe word, or a word that means safety in Gaza. They've targeted full residential complexes. The Israeli army has deliberately targeted buildings and brought out entire civilian structures. 350 families have totally been wiped out. They don't exist on the face of the earth anymore. There's no more lineage on those families. 15 hospitals have been hit. They've damaged the road. So in parts of your question, to move around is very difficult because the roads have been hit. 48 schools have been hit. And in addition to that, what's dangerous, they're using white phosphorus, a banned substance. My team saw it, and they got the smell as they went around the schools. When I speak to them, and I tell them, look, we've got these challenges, you need to bring in more manpower, bring more people to work with you, and more organizations to work with you in the event you die. And the risk is that you can die. They said, this is Gaza. We know that can happen. We form links with other organizations form links with us. So whoever dies first, the other one takes over. He said, in this case, it's far worse than 2009 and 2014. Yeah, they've thrown enough bombs on us in 6 days that was used in the whole of the war. And he said, to be honest, the only words we can explain it to the situation is to say massacre and genocide. There is no other way. And then they said we are asked to move from north to the south in 24 hours. How are you going to move 1.1 million people? The Israeli government and Israeli army are totally illogical, irrational, insensible, and monstrous. You can't move 1.1 million people when there's no cars, there's no fuel, and which person in his right mind would move critically ill patients from an ICU in a hospital across the roads?
Doctor. Doctor, if you can hear me, can you tell us how does Gift of the Givers work? That's your organization. How do they work with local partners and also non-governmental organizations and governmental entities as well in Gaza to ensure effective aid distribution?
We do ourselves. We do the aid distribution ourselves. That's a Gift of the Givers policy. Anywhere in the world, we distribute the aid ourselves. But we form partners. For example, somebody runs a healthcare center, we would provide medical support for that healthcare center. Then we have what is called a poor patient fund. We would pay for patients to get medical services at a hospital. We run a clinic, we pay for the staff that works in that clinic. We provide the medication and consumables for the clinic that we run. It's called the Kozar Clinic. And also for the hospitals in the area, we provide support for them. We support the students with bursaries. It goes directly. There's no government intervention here. It's directly with the people and other organizations. So we would support the hospitals. We would go to the house of a family and they say my roof is broken, my wall is broken. We would then repair it ourselves. We give regular support to orphans, and we give the money to the families directly. With people who are in debt and can't pay their accounts, we pay off their debt. So it's done on an individual basis, a family basis, or a structure, an orphanage, an old age home, or a hospital or a clinic. Because we have a permanent presence, we go and do it ourselves. We have our own women and child care center. It's a five-story building. We teach entrepreneurship. We have a preschool. We look after orphans. We teach widows. We do counseling. And then if they need additional food supplies or health requirements, we do that. Because it's our own, and because it's our team, and because we're well known there, everything is done by us. Nobody interferes with us. There's no government intervention. We work directly with the institutions or under NGOs to increase the speed of delivery.
All right, Dr. Imtiaz Sooliman, thank you so much for joining us on the news this afternoon. Thank you for the work that you do, and please do stay safe.
Thank you very much.